Continuing our review of specific requirements for hospice admission, we now come to pulmonary disease. When admitted to hospice with a diagnosis of pulmonary disease, these first two criteria must be met. There must be progression of the lung disease with disabling dyspnea at rest or poor response to bronchodilators, increased respiratory infections, even respiratory failure with frequent visits to the emergency room or hospitalizations. And secondly, hypoxia and shortness of breath at rest, even if there is oxygen support. Generally, the O2 sat is less than 88, and a measured CO2 level is documented greater than 50, preferably within the last 3 months. These documented observations will also support eligibility. Right-sided heart failure, secondary to pulmonary disease, a weight loss of greater than 10% in the last 6 months. There's a resting tachypulse of 100 or more. Dependence on ADLs, increased dyspnea with any exertion, even when receiving the needed care. To document continued need for hospice care at recertification, make sure your documentation describes any improvement of the patient, which we might expect, being due to the interventions that you're making by the hospice physician and team. In the next video, we're going to move on to renal disease. But remember our YouTube channel, The Hospice Care Plan. We demonstrate all the measures for comfort, care, management of the major symptoms of disease, no matter what the disease. Get our booklet for a crash course on hospice care at thehospicecareplan.com, and remember, care is treatment.